Excellent. So I think we should probably get started. Welcome to everyone today. We're really pleased that we have such a strong level of interest in this important topic. My name's Chris Malstead. My pronouns are his and him, and I'm a leader in the sales enablement team at Wells Fargo Asset Management. We're fortunate to have a panel of experienced and I think wise employee assistants and healthcare providers with us today to discuss this topic, Rehab, Rebound. How can companies help their employees return to the workplace after a mental health crisis? And what are the issues that these employees suffering a crisis face? But before we get too deep into the conversation with our panelists, I want to set the stage for our discussion here. The topic of mental health, and more specifically addiction in the LGBTQ plus community is, unfortunately, it's a complex and varied subject. So we need to talk briefly about what we're not going to cover. This is not a conversation about how to get help with a mental health or addiction crisis. Most of our companies have programs, specialists, and insurance that aid their employees with getting help, and we're fortunate for that. However, if you, a colleague, or a loved one is in crisis, here are a few suggestions about where to get some help. And if we have some time toward the end of our conversation, we can answer questions or give you a little bit more context on these resources. But what we will talk about today is what happens when an employee returns from a mental health crisis to work. What should that person be considering in regards to their return to the workplace? And what can our companies do to help and support these employees? Now, this is a conversation, and it's a journey for us and our companies. Most of them are deeply aware of the seriousness of these issues, but they're still figuring out how best to support employees while respecting medical and personal privacy laws, and of course, questions of ethics. Over the last year, Trip Davis, our co-presenter and a managing director at Deloitte, he and I have started having this discussion. With the onset of the pandemic, the topic has unfortunately become even more relevant than ever. So Trip, what was your experience returning to work after rehab?
All right, thanks, Chris. So I appreciate the introduction. Hello out and equal. I'm so glad to have you all here. I want to share a little bit about how I got here. And I, like many people in the LGBTQ community, I am in recovery. I went through a good bit of work thanks to family and friends and work colleagues even, who could tell that I was struggling and needed help, and I was able to get that help. I kind of want to start the story though. A couple of years ago, when I joined the board of Out and Equal, as I was getting to know my fellow board members, the first board meeting, they said, tell us about you. And I said, well, I'm in recovery. I've been in recovery community for about 13 years. This is part of my story. I shared that with them. Shortly after that meeting, Aaron Uritis, our CEO, and one of our Out and Equal staff members came up to me and said, hey, the staff member was also in recovery. And they said, we want to start including 12-step meetings at our Out and Equal Summit, right? We have these big events. We have, 4,000, 5,000, 6,000 people. We're in a hotel. Our companies, our colleagues, Out and Equal have tons of events. A lot of them have alcohol. We want to give support to some of our Out and Equal attendees, who are in recovery and may find themselves struggling a bit in all of this commotion that goes on around a usual summit, right? When we're all together. So that's a great idea. So we started doing that. After the first summit where we had a 12-step meeting, or a series of 12-step meetings, I went back to my office and I sat down and, in the tradition of Out and Equal workplace summits, I took a lesson home with me to my company. And I started thinking, and I said, I work at a consulting firm that has, 100,000 employees in the US. All of them go to week-long trainings at least once a year. Often there are social events and dinners and after parties, or not after hours parties, but events after meetings all day, where alcohol is present. And so, I've started, and we haven't gotten there quite yet, but I've started with my company, and I've said, hey, to our well-being leaders and inclusion leaders, I said, hey, we need to show support to our employees, who may be dealing with substance abuse issues or in 12-step programs or have other mental health issues, about these, events we have where we send them places with alcohol right there. And then that kind of led to where we get to today. Is I started thinking about that, and Chris and I, as he said, started talking. And I said, hey, what can our companies do more? What is it we need to be doing? Personally, I went off, I took a leave of absence many years ago. I was out for 30 days. Actually, I was out for 90 days. I came back to work. And, mental health issues in general, certainly addiction, faces a lot of stigma. I personally had a lot of shame around the issue at the time. And I was very closed off with my colleagues and employer and bosses at the time about what I was going through and what I was dealing with. And just made a very lonely reentry into the workforce, and made me feel like I had to be perfect all the time with everything I was doing. I didn't know who knew what. It was just very inauthentic and very lonely. Lonely is the best way to describe it. Unfortunately, a couple of years later, I did have a small relapse. Again, I went and got help. But that's time when I came back to the workplace, I thought to myself, I just said, I'm not going to live this way in anymore. I have to be able to talk at least to like my boss and some of my colleagues I work closely with, so that they know what's going on. And people were very kind, right? Obviously, they knew I'd been out, so it was 60 days, right? Obviously, I haven't gone. And they asked how I was and what I was doing. But there were select people that I started sharing a little bit more openly with, and telling them about my experience and where I was and what I'd been going through. With my bosses and service line leaders, I told them, here are some mistakes I made. I don't want to make those mistakes again. Here's what I'm doing not to make those mistakes. I also, here's what I want to do for my career. I'm still very invested in my career and my employment with my firm. And they were able then, to reply to me. I was authentic and vulnerable. And so they then were able to reply back to me with support that I needed, and to be able to feel comfortable to say, hey, what do you need? So it wasn't just me having to sort of chart my own path. And in fact, a couple of years later, a colleague came to me after he had a child who had some substance abuse issues, and they were struggling with what was going on with the child, and had a scare. It turned out not to be a scare, but everybody thought it was a scare. But because I had been vulnerable and shared with him, he came back and was like, Tripp, this is probably totally out of line. He goes, but I know you understand, and I've got to talk to somebody about this. Can we please just have this conversation? And so I was able to be there for him, and which, we're not best friends. We live across the country from each other, but we have a very strong working relationship, and that sort of vulnerability and openness only allowed us to strengthen that relationship more, so that we work better today than we ever have. So that kind of got me here. Chris, you want to share some?
Absolutely, and thank you, Tripp. I think this issue of vulnerability is really important, and being vulnerable in the workplace is just not always clear when that's appropriate and how to do it. Because I think your story, the second time you went through this, is really encouraging, but it's a little bit sad that it's not that way for everyone, and it wasn't for me. Because it was about 12 years ago, in the middle of the financial crisis in 2008, that I'd been sober for 10 years, but I fell into a spiral and found myself in a 28-day program in a rehab. And that was great. It was just what I needed. I was incredibly resistant about going, but it was just the right answer. But when I left, I was completely unclear about what I should do next. I knew that I wanted to go immediately into the workplace, but I didn't know what to do. And one of the first issues that faced me was one of disclosure. And it's something you touched on a couple of times, Tripp. How frank should I be with my colleagues and my managers about being in recovery? I had vanished for 30 days. And my performance had been pretty erratic beforehand, so it didn't take too much intelligence to work out where I probably was. but I still didn't know what to say. And this reminds me so much of coming out, which, you know, coming out is deeply empowering in the LGBTQ plus context. And I did that more than 30 years ago. And again, it helped build authenticity and trust and connection to loved ones and friends and colleagues. But is it always wise to come out as being in recovery? And I think that's an open question. I've got a friend that I know in the 12-step world in Cleveland. He's in his late 20s, and he believes that the time for anonymity for people in recovery, that it's over, that we should all be completely open about our addiction so as to reduce stigma. And it's a really fascinating idea. It's a powerful idea, and I'm not sure it's quite as simple as that. This is almost certainly one of the topics that panelists will touch on. So I'm wondering, Trip, could you introduce the rest of our panel?
Yes, absolutely. So we are very fortunate today to have three panelists with us. Todd Conity, who is Director of Clinical Services at the Pride Institute in Minneapolis. For those of you who don't know, the Pride Institute is a rehabilitation mental health hospital that caters specifically to LGBTQ community, providing a safe space for our community to come to get help with a variety of issues. Dania Harder, who is Senior Employee Assistance Consultant at Wells Fargo, and she's in Charlotte. So Dania is the person when you do call to find out what options are available to you at your company through insurance and other programs. She's one of the people who answers the phone and helps guide you through that process. And then finally, we have Craig Sloan, who is a psychotherapist in private practice in New York City. And Craig deals with many patients with, mental health, but specifically addiction issues. And Craig also, a vast majority of his patients are in the LGBTQ community as well. So we are very thankful to have them. This is going to be a bit of a discussion among us all. Again, as Chris said, this is a journey for us too. This is a chance to say, hey, what are companies doing? What could they be doing? And please let's come up with some suggestions and ideas that we can take back to our companies. Dania, I'm going to start with you. And so, what can you tell us? I'm an employee. I'm about to come back to work. I'm on the phone saying, hey, what's available? What can my company do to help support me as I come back?
Well, first of all, thank you for having me. I'm happy to be here. I think it's a great question. And, you guys have touched on a number of themes for me that really resonate. But in terms of if an employee is coming out of a program or treatment and looking to transition back to work, I think there's a lot of things that don't necessarily come to mind for them. There's a lot that they're dealing with, right? I mean, it's enough to just be trying to deal with staying sober or trying to maintain your mental health and well-being. Some people have tremendous support in that process, and that's phenomenal. And we all know that there's a lot of people who don't have any support. They've burned bridges, they've alienated people in their lives, and so they feel like they're kind of walking through this alone. And then, work is where you spend a good majority of your time. And so I think it is important to be planning and thoughtful as you are leaving a program or treatment to really do some preparation. The kinds of things I think people need to be asking is, first of all, are you ready to go back to work, right? I think some people are in a race to get there and maybe they're not ready. For other people, I think work is a tremendous asset and is very helpful on their road to recovery to have structure and routine. And certainly we want to support that. But I think you have to really be having conversations with the people who are helping you with your discharge plan or your aftercare plan to be thinking about where you're really at and what your needs are. If you're ready to come back to work, there's a lot of resources available, certainly at the company that I'm at, Wells Fargo, but many companies offer things that I think employees don't always know about or they're not aware of. So you don't know what to ask if you don't know, right? So I think the starting place is if you have an employee assistance program, that's a great place to start. It's a confidential resource that you can talk to a behavioral health professional who is knowledgeable about your workplace and what resources the company offers. And they're also equipped to help you if you need resources or referrals in your own community. to make sure you have a solid plan. I think really having, if you are able, whenever possible, having conversations before you come back to work is very important. And that is, reaching out to your manager, talking about, when you expect to come back. You talked about this concept of where's the boundary, right, from a privacy perspective. And that, I think it's an individual choice. Some people will absolutely feel, that they can benefit from being open or honest, or maybe they have a trusted relationship with their manager or someone at work that they feel like they can disclose that to. And it can be a huge benefit if you feel that you can do that. To Chris's point about the vulnerability piece, what immediately came to my mind is it's you're dealing with a lot in recovery, and absolutely, I think everyone's vulnerable in that situation. But in order to feel like you can come back to work and I think decide to have and engage in that dialogue, I think there has to be a level of trust. So if we're thinking about what companies can, I think, do more of, I think every company really probably can work harder to try to foster a sense of trust for their employees to feel safe in being who they are and disclosing where they're at in the process. Ultimately, I would say for Wells Fargo, and I think for most companies, we want our employees to be successful, right? That's our goal. We want them to be personally successful, but we also want them to be successful, of course, at work. Resources you can think about as you're coming back, and it can be very helpful to try to put this in place before you return if possible, or at least get the ball rolling, is looking at whether or not you might need an accommodation at work. Certainly mental health concerns qualify for this frequently. Addiction specifically, I think it can vary based on the ADA of what's eligible for an accommodation, but there's lots of things that potentially can be considered that may help support your return. So for example, some people will benefit from maybe having a modified work schedule initially. Maybe you want to come back and you need that structure and you're eager, but maybe you're not ready to do it full time. So that's an option that can be explored. Maybe you need some modifications in your schedule to attend treatment or support groups or classes. And intermittent leave is an option for some people as well. So I think people have this idea that you have to come back at full force, 100%, and act and function optimally at 100%, and that's not always realistic. So I think having those realistic expectations that it's a process and flexibility may be required is very important.
Yeah, that kind of brings it in the sort of idea of a needs assessment, perhaps. Mm-hmm. And Craig, Todd, I know you deal with individuals, right, who are on the backside of this, right? They talk to employee assistance people. They've gone to get help. Would it be helpful, do you think, to you and your practices, and as you're helping employees turn around and back, to have companies even say, hey, let's do a needs assessment and figure out what an employee needs? What does that sound like to you?
Craig, do you want to go ahead, or you want me to go?
Go for it, Todd.
First of all, I too want to say thank you for this opportunity, and thank you to Tripp and Chris for being vulnerable with us today. Absolutely, I believe both, in treatment or in the treatment setting as well as returning to work, there should be a needs assessment. For us at Pride Institute, we do provide residential and intensive outpatient mental health and substance use disorder treatment. And basically within days of a person admitting to services, we're starting to look at what discharge is going to look like for the individual. So we're going to assess whether the person needs a therapist, a psychiatrist, a primary care physician, a case manager that maybe helps them maneuver through a recent medical diagnosis such as HIV. And if the client is willing, we're going to have them sign releases to those professional providers because we want to collaborate and work with those individuals. And this can be part of the process for the client in sharing with their professional provider that they have gone through treatment or that they're receiving treatment for either addiction or mental health. And so really taking that team collaborative integrative approach to treating the individual. For us at Pride and for many, all providers, really we should we want to instill hope, but we want to be realistic as to what life is going to be like after primary treatment. As you know, for many that come into treatment, there's this pink cloud period when they start feeling better and life is looking better. But the reality is, to return home, the client may have gone through some behavioral, some mental health, some attitudinal changes, but oftentimes family systems, work systems, those individuals have not changed. And so they may not know how to address the client that returns from treatment or a leave. And yes, I have to concur with all of you that to break down the stigma of mental health and of addiction, that we need to start talking about this openly. And I love the parallel process of comparing this to the coming out process as a member of the LGBTQ community, is that we come out as someone that is in recovery. We don't have to say what we're in recovery from, if people, don't want to be that vulnerable, but we talk about moving towards health and healing and recovery. And so my idea is to really set that culture in the company to be open, to allow people to be vulnerable. Of course, you're not going to be open with everyone, but if there's a few select individuals that the client that returns to the work setting that they can identify, and with that, if they're coworkers, just starting the conversation. Oh, I know you've been out. Hope you're doing okay. If there's anything you need, please come talk to me. I'm open. Excuse me. So really starting that dialogue and setting the work culture that it's one of inclusivity and acceptance.
Thanks, Todd.
Sure.
Craig, did you have anything else to add? Otherwise, I have another question for you.
Let's hear your question, and then I'll answer that, and then add to the conversation.
Yeah, see which one you like better. So you're
Sure.
a licensed therapist, and you have a number of clients, as Tripp mentioned, who are LGBTQ and have substance abuse issues. In a perfect world, what would you ask companies to do for your clients?
So it's such a great question, and there actually is not, nor should we expect it to be, a perfect world, right? When someone comes back from treatment, there's as Todd was talking about, there's the discharge plan, which the facility has worked for months, possibly making out. Danya talked about the company providing resources, and then the person, as both you, Chris, and Tripp talked about, comes back to work, and we live in a world that is filled with stigma about addiction, and stigma about mental health problems, and unfortunately stigma about being members of the LGBTQ plus communities. So, when I think about addressing these issues, I think, like, what can companies do to really provide as safe a space as possible for people who, say, are trying to stay clean and sober from alcohol use in a world and a culture that, for the most part, drinks, especially at events and celebrations. And so how can we facilitate a kind of a cultural shift away from stigma so that people feel safe enough to start to open up where they, deem possible to receive some support? I mean, everyone that I've worked with in recovery who has succeeded in meeting their goals for recovery have had to meet two essential elements: structure and support, right? And so how can we find this support in the workplace?
Mhm.
So some of the ideas that I have thought about are, education, HR, and companies do company-wide events around education for lots of different social issues. I don't know how many companies actually have events for National Recovery Month, which is September, or a National Mental Health Awareness Month, which is May, right? And I know that companies have affinity groups. So, for example, there might be a LGBTQ ERG. Even within the culture of a LGBTQ ERG, when there are events, are there safe spaces for people who don't drink set up at the event? how can we help people access support while they're at work, right? So Todd and his team at Pride Institute will help people access support through, through therapy and aftercare, through 12-step and other community-based, say, recovery support outside of work. But how can people access support at work? I love the idea that, Trip, good for you for help facilitating that there are 12-step meetings at the Out and Equal conference when it meets in person. That is amazing. So can companies do something like that on a day-to-day, week-to-week basis for their employees who are coming back from treatment for mental health and or addiction treatment? Now, Tripp said something very powerful, which was the connection that you made with someone else in your company around your experience, how your experience could help someone else who is having a family member with the same experience, right? You also spoke very powerfully about how gaining the support of your manager who you trusted, to expose your vulnerability. And that, I'm guessing that the enhancement that was made in those relationships also improve your work performance, which is a win-win for the company. So
Really?
how can companies create this kind of support? I mean, one idea that I had was, what about a mentorship program that could be through EAP or through HR, confidential mentorship program for people by recovery, for people in recovery. I'm sure there are people in the company that are in recovery, that are stable, that would be willing to be like a recovery buddy for someone who's coming back from treatment. Why not set up some kind of confidential buddy system, or even support groups that could be held during lunch breaks or something like that in the company? What about when new employees come in? Every company has an orientation, right? And during that orientation, they're given the policy around sexual harassment, around diversity, around lots of different inclusion issues. Why not include mental health and recovery-based issues in those? So that can start to engender a company-wide culture of inclusion, right? So LGBT people experience a lack of inclusion in their lives. People in recovery experience a lack of inclusion in their lives. So people in LGBTQ people who are also in recovery from mental health or addiction issues have this kind of double non-inclusion issue. So why not include that as part of a company-wide culture change through education and through policy? Those are some of my ideas. And one other thing, if I might add, Daniel, if I'm pronouncing your name right, spoke very powerfully about the EAP and HR having resources for people coming back from treatment. And it's very important that LGBTQ people are connected with resources in the community that are educated and are competent and have the culture of humility and know how to work with the specific unique needs of LGBTQ people seeking therapy, seeking treatment, seeking community-based support. And so, Todd and his team and at the Pride Institute can do as good a job as possible giving people a list of who to contact, but those contacts don't always work out. That's what I mean by it's not always you can have the best discharge plan, but those connections aren't always made. So how wonderful would it be for people to have a resource within the company that have already vetted and confirmed, therapists and other community-based support that we know are going to be safe spaces for members of the LGBTQ community.
Well, Craig, and to your point, I'm kind of looking at, there's a lot of comments coming in, and I'm trying to kind of read through a bunch of them, and I don't think I'm going to be able to answer all of them, but a couple of things I just want to hit on that touch on what you're talking about. And I think one person mentioned that I think they accessed their EAP and they were unable to find an available provider. And I think depending on where you live geographically too, and of course now with COVID, right, we're in a very different, unique time, and we can talk about that in a little bit. But It can be challenging sometimes, depending on your needs, to find a provider, and not only just any provider, but a provider that has the expertise that you're looking for, the specialization that you're looking for, and that's a good fit for you, right? Not every provider is going to be the perfect fit for every individual. I obviously can't speak to individual situations because I don't know, but I will say I can speak from my own experience working in employee assistance at Wells Fargo. If we are challenged at finding you what you're looking for, one, we need to keep trying. Two, we may need to problem solve with you around what is available, right? So maybe right now there's a wait to get in with somebody, or there's not a perfect match for you, but then we need to figure out a plan for the interim, right? That would be the goal. I mean, I think we try to meet each individual with where they're at, and to Trip and everyone's point about kind of doing a real needs assessment. Your specific needs may be very different than another employee who's returning. And so when you call us, our goal is to assess your situation, to look at your circumstances, to look at what you already have in place that's going to be beneficial and helpful, and what you're lacking, and then to help you ideally put a plan of action together that's going to help you to be planful and purposeful about some of the challenges you may experience. Somebody else asked the question as well about what kind of support is available to managers who are trying to support employees coming back with these kinds of scenarios. And I will tell you,
so important.
That's what I do on a daily basis in my role at Employee Assistance for Wells Fargo. Is we spend a lot of time, just as much time, if not more, actually supporting and educating managers on what this looks like, withholding judgment and not making assumptions, and trying to diagnose and assess people on your own, and really trying to look at how to be genuinely empathic and authentic and supportive to individuals' needs. Now, with that, we all recognize the world that we live in, that employees still need to be held accountable. If you are not meeting the expectations of your role, and you're not performing in your job, or your conduct and your professionalism is not there, those are still real issues that need to get addressed from a management perspective, right? So employee assistance, I think, is a great resource in HR for trying to help management navigate how you successfully deal with that, where you can still be supportive and empathic, but you can still hold someone accountable. And frankly, sometimes those frank conversations about what you're observing and what you're experiencing with an individual is feedback and a conversation that needs to happen for somebody to get the help that they need. Sometimes their insight is lacking, or their readiness is not there until there's a consequence that they're kind of faced with having to make some different choices. So we can coach around that dialogue, or how you approach those conversations in a sensitive but supportive way. So that's just another piece of it.
Dania, I just want to emphasize this, because I think I heard you right, and I want to make sure, at least at Wells Fargo, it sounds like EAPs or your department takes a very proactive role when employees are coming back to reach out to managers and say, hey, let's have a conversation about this person coming back.
Well, yeah, so let me clarify. We're a voluntary program at Wells Fargo, which some companies actually mandate employee assistance, especially if there's a substance abuse or an addiction issue involved that has involved the workplace. We're entirely voluntary. So that's true whether you're a manager or an employee. So we don't necessarily outreach, but we do a lot of educating to managers. In fact, we've even created toolkits specifically for managers as well as employees on the topic of substance abuse and dependence. And it's got resources, it's got information, it's got things you should and shouldn't do, or even how you help a fellow coworker if you're concerned that this is an issue for them, how you engage in that. So we've tried to be proactive in terms of putting the information out there. We do lots of facilitations to Craig's point on presentations to managers and employees on this topic around what does this look like? How can it affect the workplace? What can you do? What help is available? And also what help's available even outside of the company. We recognize some people will just not feel safe using the resources within the company, even if they can be beneficial. Our goal is to make sure you get help, bottom line.
Right. Yeah. So maybe one thing, come to start thinking about is maybe not specifically about, John Smith employee coming back to work, right? But in general, a bigger package to managers or managerial level people and above in general, saying, hey, you're probably going to be faced with this situation in your career now as a manager of people.
Mhm.
Here are some things to think about.
Mhm.
Here's things, that somebody's been out on leave of absence. Maybe they're not sharing everything with you about what happened, but you need to be aware of these things. Here's a resource, right?
Mhm.
Here's Dania. If you have questions, you can call her too.
Mhm.
Being the manager with the employee
Right.
coming back, you can also call her and say, hey,
Right.
I'm struggling with what to do and how to judge and what I can and can't say and all that stuff. And so there's some support there too from the manager side to help out with that.
Right. Well, and our program's 24/7, and I think most employee assistance programs nowadays are, that you can contact a behavioral health specialist around the clock. For employees, it's confidential, so it's a safe place to talk about your concerns, maybe talk about what your triggers are. I mean, there may be triggers at the workplace for you and that you're fearful of coming back into that environment. That's completely natural, and I think it's understandable, but you still have to be planful and figure out how are you going to address that then. Don't wait until you're in the situation and then you feel like you're back in a crisis mode.
Yeah.
Thank you, Dania. This is Todd. I saw in the comment box, someone had mentioned that mental health and addiction recovery is not linear. There are ups and downs and it ebbs and flows. And that is one of the things that I think is really important to really, for clients returning to the work setting, having a realistic talk about what they may experience and expect over the next, couple of months after leaving a treatment setting and returning to work. As you know, for some individuals, there's an exacerbation in symptoms, whether mental health or in substance use. For many of those with addiction issues, we look at what's known as post-acute withdrawal syndrome, where there's a spike in increased emotionality or emotional lability, coordination issues, sleep issues, appetite issues. Talking about that, recovery is a lifelong journey. And I think some people think that's episodic. You do this one thing and then I'm taken care of and I can go on with my daily life. But ensuring that clients or patients are educated on what recovery may look like after treatment. And that, depending on where the company and policies, another short-term leave may be warranted, or they meet, like you had mentioned earlier, Dania, about maybe an intermittent leave. Just as someone with, if we look at mental health and addiction as a medical or disease model, just like anyone else with a physical health condition, we need to make accommodations to support that. But what I'm trying to say is I think education to the client is imperative. And I think someone had mentioned COVID as well. And as we know, recovery for both mental health and substance use, support is like one of the #1 top elements that can contribute to success in recovery for both. And during COVID, we have seen, unfortunately, a whole lot of relapsing going on, both mental health exacerbation and substance use due to that inability to connect to others. And Zoom meetings are great, and support meetings like SMART, 12-step Dharma, Buddhist recovery are awesome. But doing Zoom, you miss that human connection, which returning to work is something that, would provide that connection to other individuals if there's people there that support the client returning to work. And my role is really before the client returns to work, you're the experts in when individuals return to work. I love the ideas of having a resource portal or bank for individuals to access, to have as part of the orientation process for managers. This is how we talk about mental health and addiction issues, and the education to all employees surrounding mental health and addiction, I think is very important.
Yeah, the education of the client is really important, as Todd was talking about returning to work. And I, someone wrote in the chat box, half the battle is battling through that corporate culture fear. It's easy to neglect self-care in place of getting the job done, especially in a virtual environment. And so there it is, education of the client as they return to work is vitally important, but education of the management team, who can be who are can be such a source of pressure for anyone in the workplace, let alone people that, are coming back from some kind of returning to work from some kind of a treatment. And, oftentimes it's management that is setting the tone for the culture of the department and of the company at large. So like, I cannot tell you how many, clients I've had in my practice coming back, in early recovery that are, terrified of the client dinner because they know what's going to happen there and they know what questions are going to be asked, why aren't you drinking? Right. And so having the support and especially within and having the support of the senior staff that are at those events, to mitigate some of that is going to be super helpful. It's really about culture change, and that takes time. It takes a long time, but it can start, today.
Well, and one of the things, I really want to highlight, because I'm seeing kind of some of the earlier comments was talking about the stigma and the perception that the stigma with mental health is perhaps different than the stigma of substance abuse issues. And of course, we know that some people struggle with both and have dual diagnosis concerns. And, certainly I think there's stigma regardless, right? I mean, that's what we're trying to overcome. And so I would say the same thing that I said before about the education piece with management. We've recently just created a presentation actually on mental health in the workplace that's for all employees and managers, where we're trying to educate on really what is the truth about mental health and fighting some of the myths and really talking through the stigma that society seems to have had in place for a long time. The only way to remove that is to engage in these conversations and to educate people and to normalize this. I mean, I would venture very comfortably to say that every single person participating today, either personally or themselves or knows somebody who has struggled or does struggle with mental health or substance abuse issues. So when you look at it with that lens, to me, this is very personal for all of us. It should matter to all of us. And I think those are the kinds of dialogues we need to be having more of when it comes to the workplace, that this isn't something that should be an awkward conversation or an uncomfortable conversation. And I recognize the shoulds and the reality are two different things sometimes, for sure. It takes courage to engage in these conversations. And I see some specific questions for people, specific scenarios, and I think it's going to be a little hard for us to get into that here. But in terms of, if you know what your triggers are, I think there's a number of ways to go about trying to address that. One of which at work is to try to engage, if you can, and you may not be able to, if you can engage in a conversation. Somebody talked about their manager being a trigger. If you can engage in a conversation around how you're experiencing that individual's behavior and how it's affecting you, it's a start. Now, I recognize it may not be the solution, but that's what you have control over, is trying to put your truth out there and your observations out there and to ask for what it is that you need. If that doesn't work, then there should be other resources within your company that you can then go to try to get further assistance if that's not helpful. So that may be HR, that may be employee assistance, that may be one of the other resources we've talked about. But I think it does require some conversation with somebody to address the concern and the trigger if it's something that you feel like is a true barrier or hindrance for you.
Dania, I saw that note, and I saw also another one with someone who already knew what their triggers were, right? And they were trying to take a proactive step towards saying, hey, can I talk to you, manager? Here I have these triggers, and so maybe I think this one was particularly around the time of year, right? And so recognizing, I recognize what my weaknesses are, right? I recognize when it's time for me to leave a party or time for me to go home.
Right.
Same kind of thing, just in a work situation, right? I recognize when I know that I'm getting close to my edge, and so it's time for me to pull back.
Well, and when it comes, I think so, if you're dealing with a trigger as a person, I think it's always helpful if you're engaging in that dialogue to try not to make it necessarily like you're finger pointing at the person, but to identify what it is about that individual's behavior or what they're doing or what they're saying that you feel is impacting you. And then talk about those behaviors. So when someone yells at me, here's how it impacts me. Here's how I respond to that. Here's what I need. Or when somebody is, asking me lots of questions rapidly and I feel like I'm put on the spot, I don't respond to that. Part of it is educating them about what you're experiencing and how you're seeing it, even if they disagree. And then for the person who identified some triggers, just some things that have happened, and they know that it's the time of year or something else that can make it tough for them. I think it can help to have a conversation, but you also have to be thinking about what is it that you actually need then. If you have that knowledge that you're less productive, you're less focused, you're having a harder time, maybe you need a little bit of a break during that time to engage in some treatment or to be talking to somebody who can help you through that, versus trying to push through and having some negative consequences because you're not able to perform, at the level that you need to be.
Yeah. Craig, I know you see a lot of individual patients. I'm sure you hear the same story. You hear what their triggers are. You have lists of them. I'm sure you take notes. Like my therapist takes notes all the time. I'm sure that's what she's writing down. But what do you, thinking about those kind of lists and what you're seeing with your clients, what do you see else that companies can do to help? Where are we falling short? Where are we not supporting our employees?
I would say ask them. I mean, why not? We're talking about doing a needs assessment. So what about doing a confidential survey of staff to find out what needs are met and what needs are not met? I mean, that's how, there was a time in the corporate community that it wasn't safe to be out as LGBTQ in the workplace. And now for many people, it is, not for everyone. We still have a long way to go. But how did that happen? Right? And let's look at how that happened and how safe spaces were created. And it was through policy and education. And through the policy and the change and the education of the company-wide education, that culture started to shift, right? And the world at large was shifting, our country and the culture was shifting too. I mean, granted, we still have a long way to go, but each company is kind of like a little micro system within the culture. So the companies need to, in my opinion, would be helpful to look at how can they change from within. So if the question is, what can companies do to help the staff, ask them and see what comes up and give them a voice, right? That's how LGBTQ people became more accepted and more empowered, is by being granted a voice and being able to come out of secrets and shame.
Craig,
I'm sorry, go ahead.
sorry, Dania, please.
No, I was just going to say to Craig's point, I think there's strength in unity too, right? So you give it a voice, and a powerful voice when you can bring people together. And I think that makes a huge difference. We talked about support groups and what the ideal would look like and what exists in some places. And, not every workplace is going to have the perfect solution. They may not have the exact support, group that you're looking for. We've got lots of, we call them team member networks at Wells Fargo. We've got lots of those for various, things that are commonalities that people share. So we've got the Pride team member network. We've got a veterans team member network. We've got a women's team member network. All kinds of things, diverse abilities for people with disabilities. Those are opportunities for people with commonalities to come together, to support each other, to talk about the issues that are meaningful to them. They're sponsored by the workplace. And they can have the dialogues that that they want, and it also helps, I think, tremendously with educating. And you don't have to have the specific commonality to be a part of those team member networks. Anyone can join them. I've joined several just for that reason, and it's been tremendously helpful for me, just from an educational standpoint of getting a perspective I would never have gotten had I not decided to listen to those voices.
Yeah.
So I highly encourage something like that if it doesn't exist in your companies.
And this point around team member networks at Wells, employee resource groups more broadly, that's the point I was going to raise. And I think we'd be remiss if we didn't note that the chat on the Zoom side, at least, had some really interesting points made around the power of employee resource groups in this area, and that one wouldn't necessarily need an ERG focused entirely on mental health, and that through the lens of intersectionality, any ERG really can be focusing on mental health and addiction. in the population that they represent.
Great point.
That was a clever point in the chat. I'm just voicing it.
Yeah, and I apologize. I'm trying to follow the chat while I listen and talk, so not as easy. Thank you for bringing that up.
All right, so we're down to about the last 10 minutes. If you have some questions, if you want to put them in the Zoom chat, that's the easiest it seems for us to see. We'll keep trying to answer some of those. I thought we could kind of just go around, let everybody on the panel have a couple of minutes to sort of give some last thoughts or closing thoughts about what we've talked about, some things that you think our listeners maybe that they should be thinking about as they go back to their companies. I'll start and say, one thing that's come to my mind and I've realized is that, I work at Deloitte and, every project, it's a consulting firm, right? Every project we have, I have a new group of people working for me. So I'm touching different employees all the time. And I know, I can be better about our kickoff meetings for our projects of saying and making it clear, saying, hey, this project's coming up, it's going to be busy, we're going to all be working hard, long hours, but hey, I know things happen during projects, right? If you're feeling tired, if you've got a family issue come up, if you've got, a medical issue come up, please come talk to me and tell me sooner rather than later, and whether it's traditional medicine, what we think of as traditional medicine, or, a mental health issue, for you or your family, like I am here to support you. I want you to be healthy. I want this project to go well. I want you to do well, both in this project and at Deloitte. But, if you come talk to me, I will be supportive and help. And I think, just starting those conversations earlier, and I'm one person, right? We have a lot of employees, but even, maybe hopefully getting that pushed out broader so that some of the trainings we have even talk about mental health this way, in a way that, Deloitte has employees. That's all we've got, right? We've got some computers and a little bit of technology and some IP, but it's our people that matter, right? Our people do the work, our people do the consulting, our people come up with the ideas. So if our people aren't healthy, we put a lot of money and a lot of investment in those people. So if they do need help, if they're in a crisis, I want them to get help and be healthy and to come back and to feel supported and be successful and help us make money back at Deloitte again. But that's what I'm thinking back for my teams, definitely every time, as well as some of these other ideas to talk about with our inclusion and our well-being departments. But Dania, what you got?
I guess what I would just say is, I often hear people say, I asked for help and I didn't get it. So then I just figured it wasn't worth bothering. And that's really sad to me. I've heard that where people will say, I went to my manager and they didn't understand, or I didn't feel supported. And so I just closed down. I didn't have the conversation anymore. I didn't talk about my needs. And I figured that if that was that individual's perspective, then I guess that was that they kind of extrapolate that to how the company is approaching it. And I really want to emphasize that I don't think that that's necessarily true, or it doesn't need to be. I would encourage you that if you don't get the support, don't make it about one person. So if you don't get that support from your manager or the person that you're seeking that support from, know that there's a plethora of other options. And it may be in your company with your EAP, it may be your HR person, it may be your second level manager, it may be a peer or a mentor or somebody else. But don't give up. Keep trying to find that help. I can't emphasize that enough. If you keep looking, you will get it. And if you truly are in crisis and you don't know where to get it, then some of the resources that were shared in the beginning of this, I think you certainly can reach out to and they can help you get connected. There's national hotlines, there's all kinds of resources. Somebody asked about, do I need to use EAP if I've already got resources and support? And that's a really good question, because if you've got therapy or you've got a good support system and you're utilizing it and that's working for you, that's wonderful. But sometimes you're in a moment where you're in crisis, and it doesn't even have to be a crisis. It could just be that you're just having a really hard day, and maybe it's 9 o'clock at night and you can't get in touch with your therapist, or you can't get in touch with your support and you're struggling. Just having somebody that is a safe, professional person who can help you talk through that with you, listen to you, support you, and guide you can be really beneficial. So think a little bit outside the box. It's not necessarily, you know, maybe what your perceptions are. You can get help in a lot of different ways from different resources and different people.
Thanks. Craig?
Yeah, thank you guys for putting this together. It's really, really important topic and one that's close to my heart. So, I mean, what I would have to say in closing is that recovery is possible. If there's one person who's watching today that's struggling and doesn't, you know, believe that they can recover, I mean, we have 2 people here on the panel today that are living proof that it is. So recovery is possible. And I agree with Dania, do not give up. Ask for help. If you don't get it, ask for help again. If you don't get it, ask for help again. No one has to go through this alone. And there are many, many resources out there. If you can't find them in your peer network, look for them outside of that. Look at them for them outside of that, and look for them outside of that. Do not give up. Recovery is possible.
Thanks, Craig. Todd?
So I too want to say thank you again for this opportunity. I am just reminded of the LGBTQ community and how resilient and remarkable we are. We have overcome so much in our histories, and we've broken down the shame and stigma that has often been attached to our LGBTQ plus identity. And it's events like this and conferences and the work that's done day to day in companies like each of you represent that breaks down the stigma and shame of mental health and addiction issues. And we just need to keep talking and sharing our stories and role modeling to others that recovery is. You know, I'm just going to be honest, over the last 6 months with the pandemic, we've lost a number of clients to their mental health or addiction issues, and it's devastating. And we don't want to see that happen to anyone. You're feeling you need help. Thank you.
This might be important. Someone put in the chat box, what does EAP stand for, and how do I know if my company has one?
What a great question, and I am so sorry we didn't we didn't educate on that in the beginning.
We are down to 2
EAP.
minutes, so we're going to get cut off, so go quick.
Okay, stands for Employee Assistance Program. And if you have a benefits book or an online benefits site, you should be able to see if it's there. You can always call HR and ask as well.
And let me briefly wrap up. So much wisdom on the panel, so much wisdom in the chat rooms. Thank you very much for engaging in these multiple ways. You know, in a way, this touches on what Todd just said. I'm really struck by the example, the history of the resilience of the LGBTQ plus community and their struggles to step into the light and to claim what's theirs. I think there's a very similar path for us in recovery to do the same, because in most cases, my experience has not been that people who say, why aren't you drinking? They don't mean something bad by it. They just don't know. It's never occurred to them. And it goes back to what was said at the very beginning. I have to be courageous, to be vulnerable, and I can be an example if I'm sufficiently courageous to have a relationship like what Tripp described, where colleagues are coming to me and asking for my experience. I can be more valuable at my firm, and I can do things that help make my recovery mean more to me. So there's an example in the LGBTQ experience for us. So I think that may be it for this afternoon. Thank you all for joining us. We will upload a PDF with the resources that we put up in the PowerPoint. And thanks again for your time.
Thank you.
Thanks, everybody.
Thank you.
Thank you so much.